Hi everyone, I'm Dr. Evelyn from Petsadena Animal Hospital. Let's talk about some common parasites. First, we're going to cover intestinal parasites. Intestinal parasites are organisms that can be microscopic, but aren't always. Sometimes you can actually see them in your pet's stool. There are a few common intestinal parasites that we tend to see more often in our dogs and cats. Those include roundworms, hookworms, tapeworms, giardia, and isospora. Intestinal parasites usually attack the intestinal cells and cause damage and inflammation, which can then lead to symptoms you might see in your pet. That would include diarrhea, soft stool, bloody stool, potentially vomiting, even a reduced appetite. Sometimes in severe cases, intestinal parasites can even cause weight loss, depending on the type of parasite. Some parasites can also be zoonotic or transmissible to people. Those are even more concerning because if your pet has one of those parasites, you could potentially contract it, or a family member who has an immune system that's compromised, like an elderly person or a child, can potentially become infected and have dangerous complications associated with it. Typically, the parasites that are zoonotic are transmitted through ingestion of the parasite eggs from contaminated environments. Hookworm in particular can also cause transmission through the skin, which can be dangerous when people are outside barefoot. Some of these zoonotic conditions that these parasites can cause in humans can potentially damage organs or even be life-threatening. This is why it's very important to make sure that your pet is protected against these parasites or commonly treated for these parasites so that we can prevent these transmissions. The good news is that there are ways to prevent and treat parasites. Prevention starts with having your pet on a monthly dewormer or anti-parasite treatment. Luckily, our heartworm prevention and some of our flea and heartworm combination preventions have a product that will deworm your pet on a regular basis, monthly, such that if they contract any of these parasites, they're going to be treated for them very quickly. Another way to have your pet have a regular deworming protocol is to bring them to the hospital and have the anti-parasite treatment administered here. Sometimes we can even send it home for you to give on a regular basis. Typically, we'll recommend to give deworming treatment every 6 months, even if your pet has negative stool sample checks. Getting your pet's stool checked regularly for intestinal parasites also helps us ensure that they're not picking up parasites, and if they are, we can go ahead and treat them in a timely manner. It's typically recommended that your pet receive a stool check every 6 months, even if they're on anti-parasite treatment, to make sure that we check for other parasites that the anti-parasite treatment may not cover. The next type of parasite that we're going to discuss are fleas and ticks. Fleas in particular are not only a nuisance as they can cause excessive itchiness, skin conditions in your pet, even allergies. They can also be dangerous because they can transmit intestinal parasites such as tapeworms. The other problem with fleas is that they multiply quickly. A flea's life cycle is about 100 days, which means for several months they can potentially invade the environment and create more fleas. A single flea will produce about 40 to 50 eggs per day, which means a female flea can produce up to 2,000 eggs in their lifetime. That's a lot of fleas and usually will lead to a significant infestation that's very difficult to manage and control. Luckily, flea prevention has almost eradicated that problem. As long as your pet is on a monthly flea prevention and you're making sure that you keep up on that prevention regularly, you're going to hopefully prevent these kind of infestations and keep your pet flea-free. I do want to note that flea prevention is not a flea repellent. So your pet will likely still be exposed to fleas, and a lot of times the fleas have to get on your pet and bite your pet in order to die from the flea prevention treatment. That being said, it's still going to allow us to get the fleas out of the environment much more quickly than if we didn't have them on a preventative, and it won't allow them to reproduce. This is why it's important that if your pet's on a flea prevention and we do see fleas, we potentially look into an environmental contamination and address that accordingly. Not only are ticks gross to look at, but they also transmit some pretty serious diseases, including Lyme disease, which most people know about, and a disease called Ehrlichia that can be found in cats and dogs. Now, ticks do need to be attached for a specific amount of time before they can transmit disease. This is why it's important that your pet's on a tick prevention in addition to a flea prevention that covers fleas and ticks so that they're unable to transmit disease. Typically, a tick has to be attached for at least 24 to 48 hours before it'll transmit disease. This is why if you take your pet on walks, hikes, areas where there's potential for ticks, it's also a good idea to check them thoroughly for any ticks that may have attached during your walk or hike. A few of the clinical signs you might see with tick-borne disease would include potential unexpected bruising, limping, excessive lethargy, reduced appetite, overall your pet just not feeling well. Some of the signs can be more serious and obvious, some of them are more subtle. If you do notice ticks attached, it's important that you have your pet seen by a veterinarian so those ticks can be removed thoroughly and appropriately and for your pet to be assessed for tick-borne disease. We've just covered a small subset of parasites that we can find commonly in our dogs and cats. There's many, many more out there, and if there's any questions about parasites in your pet, please feel free to ask us. Thank you for choosing Petsadena.